Oh, so they're just coming out and saying it now. They want us all to work until we're dead. My name is Brittany Page, and this is the Page Perspective. We've started to hear conservatives talk about increasing the retirement age, but the news this week is really taking things a step further, and we're going to combine two things here. First, we're going to have a clip of Dr. Oz, the Centers for Medicare and Medicaid Services administrator for the Trump administration, if you can believe it, talking about his number one priority, the economy. And second, we have new reporting from the Washington Post showing the disturbing lengths that the Trump administration is willing to go to inflict harm on older Americans and older Americans with disabilities in particular, including secret plans they're considering for forcing older Americans with disabilities into jobs. Now, this thinking has been in conservative circles for a while. Just last year, multimillionaire podcaster Ben Shapiro said that retirement is a stupid idea. The right is making it pretty clear that they hope that those in poverty are able to work until they're in the grave, regardless of age or disability status. And now Dr. Oz is following his orders and ensuring that in his role as CMS administrator, he is not concerned primarily with the health and well-being of Americans. No, he is first and foremost concerned with the health of the economy. And in his mind, the health of the economy requires that older Americans approaching the end of their lives really continue to hustle and grind because, well, the American economy needs you. Here's Dr. Oz at an event hosted by the Aspen Institute discussing his priorities this week.
Born in 64, you're going to retire this year. If we could get you, just that one age cohort, born in 64, to work not to 61 years of age, but to 64 years of age, or even 65, it's worth more than $1 trillion to the U.S. economy. The value of this most beautiful safety net that we have in Medicare, and Medicaid, by the way, as well, in the exchange and CHIP, the beauty is we get people healthy so they can contribute to society. That's the unbelievable return on investment. $1 trillion just by getting one age cohort to work 3 years longer, which if they felt vibrant and vigorous in life and fit, they might want to do that anyway.
Well, there are a lot of people who also need to do that because they can't afford to retire.
Yeah, but there's many reasons you might want to do it, but I don't want your health to be the reason you don't do it.
Don't you love how he brushes off the fact that many people actually work beyond retirement age because they can't afford to retire? Like, yeah, we're not concerned with that. We want people hustling and grinding until they're in the grave. And the context for this statement was a question that he was asked about work requirements for Medicaid, specifically the failed work requirements in Georgia, where they've spent twice as much on administrative costs than the actual healthcare, totaling at least $54 million on just the administrative costs of rolling out the work requirements. This happens every time. Instead of, funding work requirements that exist solely to kick people off of Medicaid, you could just, fund Medicaid. But no, why would we do that? We want to blow tens of millions of dollars paying Deloitte to disenfranchise people instead. That is the Republican way. Dr. Oz's comments and the broader position of Republican leaders are both particularly troubling in the context of a new report from the National Council on Aging and the Leading Age Long-Term Services and Support Center at UMass Boston, showing that poverty quite literally steals years from your life. Quote, older adults with the fewest financial resources die on average 9 years earlier than those with the greatest wealth. The study, which draws on nationally representative data from the Health and Retirement Study, highlights the widening wealth gap among Americans age 60 plus and the devastating impact of that gap on health and longevity. Quote, it is shocking and unacceptable that in the United States in 2025, poverty steals almost a decade of older Americans' lives, said Ramsey Alwyn, NCOA president and CEO. Millions of older Americans who worked hard and played by the rules are dying early simply because they don't have sufficient financial resources. This is a call to action to change our policies and systems to ensure that every person can enjoy the gift of longevity, not just the wealthy. And that's right, because millions of older Americans spent their entire lives working working toward the idea of a relaxing retirement where they don't have to worry about money, only to be told that actually the economy needs them to keep working. The health and well-being of Americans, we know by now that that is just not a priority for Dr. Oz, for Donald Trump, for the entire Trump administration. And we know this because this is all coinciding with new reporting from the Washington Post on the Trump administration's plans to make it harder for people with disabilities to qualify for assistance. Quote, the Trump administration is preparing a plan that would make it harder for older Americans to qualify for Social Security disability payments, part of an overhaul of the federal safety net for poor, older, and disabled people that could result in hundreds of thousands of people losing benefits, according to people familiar with the plans. Conservatives have long argued that since Americans are living longer and fewer have jobs that require manual labor, many physically disabled workers could adapt to desk work, broadening their work options and resulting in fewer people being granted disability benefits. Social Security officials prepared to issue a similar rule at the end of the first Trump administration, but ran out of time. All of this, again, predicated on the lie that conservatives tell about people wanting to simply mooch off the government. They refuse to acknowledge the reality that is people sometimes need help. And if we want to have a thriving society, we should create the conditions that care for those who are unable to work due to age or disability. Instead, this administration is investing more than $300 million to create a database, which will display jobs people can work when they apply for benefits, so they can be redirected to work rather than obtaining benefits. Now, remember what I just read to you about ProPublica and their reporting about the many millions of dollars that Georgia paid for the administrative costs for work requirements for Medicaid, rather than just paying for Medicaid? That's what this is, but in a different package. Quote, according to two former officials, starting next year, the agency plans to develop a computer-generated database using the modern jobs data to determine which jobs, if any, someone seeking benefits could perform. Disability advocates say they worry that the database will be programmed to come up with a vast array of jobs, particularly if advancing age is no longer a limiting factor, and will end up denying benefits to tens of thousands of claimants every year. Michelle Spadafore, a senior attorney at New York Legal Assistance Group, said she frequently finds older disabled clients are not able to go back to work if they are denied benefits because they struggle to keep up with the technical and physical skills required of modern work. In addition, employers may be less inclined to hire workers nearing retirement age over younger hires. Quote, you wouldn't stop working because you reach a certain age and you think disability benefits are the next logical step, Spadafore said. Nobody does that because disability benefits are almost always less money than full-time wages. And this is really a key point, especially in the context of this. Quote, more than 15 million Americans receive monthly disability checks as part of two programs: Social Security disability insurance for those with a work history who have become disabled before retirement, and supplemental security income, an anti-poverty program for poor, elderly, and disabled people that pays about $800 per month. If people could work, they would. Wages pay more than benefits. Even Dr. Oz loves to repeat his line about the average number of hours of TV someone on Medicaid watches per day, rather than going out and being productive, advancing the same tired myths about lazy, poor people watching endless hours of TV. And has he met Donald Trump? I don't know. There's so many rich people across the country who get all kinds of government benefits, and we never sit around wondering how many hours of TV they're watching. All of this is simply a bias against the poor. That's it. Blaming the poor for their situation instead of the systemic failures that all of these Trump officials are now trying to expand. And you know what? This may be the most maddening part of all of this. I watched the entire over 1 hour interview with Dr. Oz from the Aspen Institute. Probably not the best use of my time, okay? And he quoted a quote that he walks by in his office by Hubert Humphrey. And I want to share it with you now. Quote, "The moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped." How Dr. Oz lacks the self-awareness after his many years of existence and his extensive education to speak these words aloud while he is actively pushing for people who are approaching the end of their lives to continue working for the economy as his party upends public health, guts Medicaid and SNAP, all to pay for tax breaks for the wealthiest Americans. I really don't get it. This is a moral test, Dr. Oz, and you and the entire Trump administration are failing that test. As always, I would love to hear from you on this. Please share your thoughts in the comments below or call and leave me a fewer than 3-minute voicemail at 202-656-1509. You can always send an email to info@thepageperspective.com. You can support my work, as always, by becoming a channel member. You just click the join button below for as little as $1.99 a month. You can also go to patreon.com/IDoubtItPodcast. You can follow me on social media at Brittany Page, Blue Sky, Instagram, Threads. And as always, thank you for being here. Take care, and I'll see you next time.